Well, welcome 25 financial clients. We are sitting here with Dr. Matthew Song, orthopedic surgeon from Michigan, and sits on the board of the Guatemala mission that we are partnering with called Send Me. I asked Matthew to jump on with us today because we are interested in this trip that we're offering to clients, to you, to come with us to Guatemala and to a rural town called Joyabaj. This is a place that Jeff, another advisor, Brian, and I went to in October of 2025. There is a 2026 trip that we are offering October 17th, Saturday, through October 24th, Saturday. And this is a first for 25 Financial. A little background that I'll give high level, Matthew, and then I'll just try to sort of ask you some questions on your end of some of the things we were talking about offline. But a little background and just edit what I'm about to say and sort of like maybe expound on some of it just on Send Me as an organization, your connection with Send Me. I believe you sit on the board as an orthopedic surgeon, practicing orthopedic surgeon in Michigan, also on the board at Send Me. And that Bill Vasey back in 1968 went down there to Guatemala in a station wagon, two kids, to translate the New Testament and then the Old Testament after that in Quiche, and actually developed an alphabet. And that was back in 1968. And fast forward to approximately, let's say 10, 15 years ago, George and Tammy Roller took over the Send Me vision. And it really just sort of blew up from there. And really the branch that we're focusing on now of ministry that George and Tammy are looking to accomplish, you on the board are looking to accomplish, are really on the medical side. And we have the Spanish speaking people of Spanish descent that make up maybe 15, 20%. They're professionals. They have a little bit more money. Then you have the Quiche people of the Mayan descent that are a little bit more, I'll use the word discriminated against, and that we are sort of targeting for medical and other services. And so that's the high level as I understand it. Please correct me, edit it, and then maybe fill in how you fit into the Send Me organization. When did you start? What's your passion? And then we'll get into later in the conversation specifics that you would recommend for our clients if and when they choose to come down and participate. So thank you for taking the time and welcome.
Yeah, thank you. First, starting it off, I started going down there first in 2017, and at that time, there was no medical outreach whatsoever, and we were there initially for the Jesus film that was being launched in their own language, which was amazing. And then we went into the schools with it, and we started. I led 2 mission trips there that were for building only, that we built a fourplex for widows, for homeless widows and their children. As we were spent some time down there, we realized just the incredible medical needs, and that these people had no care. And even if they had enough money to get care, they'd go into the city, which they had to travel hours to go. To get to Guatemala City, it's about 4.5 hours. They would a lot of times get turned away because there is this built-in prejudice against this people group. And for anybody that remembers, there was a 30-year civil war between the original Mayan people and the Spanish people. And so there's still a lot of hard feelings that go on. And so we really had compassion on their needs. And when I got started, I had no clear idea of what I was going to see. And I think that's going to come up later in our discussion, but we just felt we had to do something. And our first step was to get a mobile medical clinic, and we call it Compassion on Wheels. We got a 40-foot bus that we totally remodeled. In fact, it was remodeled in St. Louis. And with actually, there was about 4 or 5 churches that helped and send different teams, and it took us about a year. It took us over 6 months just to get it through customs. But now it's on site and fully functioning. We have a fully functioning operating room and a fully functioning dental unit with 3 air conditioning units, and it has filtered air that comes in. There's water, there's clean water, there's bathroom, there's air pressure, there's suction. We did 105 dental procedures in the last trip, and I did 9 orthopedic procedures. That was in a 2-week period of time.
What are your thoughts on why a hospital, why a location versus doing maybe, keeping the mobile on wheels? What would a permanent location, what's that sort of that vision look like for a permanent location, and how maybe hiring Guatemalan staff? My assumption is we're going to hire Guatemalan physicians. The idea is as we bring American teams in, it helps train those Guatemalan physicians that would be boots in the ground for generations to come for this Quiche people specifically. But maybe talk a little bit about a permanent space, the hospital. I've seen that mobile Compassion on Wheels, beautiful bus, and looks like it's doing great work so far.
Our vision right from the beginning was a hospital. I've been in other parts of the world where I've seen the transition. There's now a missionary who's 97 years old, who started a hospital in a rural area of Taiwan, and he started operating on the back of his van, or in his, he started very crudely, and over a course of 50 years, he built a very nice hospital, and he trained the locals, and it's now a fully functioning hospital. And so what you need to view this as is a transition. These people they're not getting any care that you would consider reasonable. No one in the United States would be able to recognize it. I usually say there's 3 different things you have to think about. One is what you do immediately. How can you help them immediately? And then what's the next step, over time. And over time, we will need to train. We'll need to build a facility that would attract somebody that they want to spend, a life working there. And we will want to train locals they'll be committed to this area and to these people. And then eventually you work yourself out of a job.
Yeah.
But you feel that you've made a difference, that these people, they're not getting care at all now. And I'll go into that just a little bit. Just the horrendous pathology that I've seen.
Let's do that. So talk about the medical need now. That's sort of where we're at in 2026, and then we'll get into for clients that are considering this trip in October of 17th through 24th of this year. What we're going to sort of recommend and what to expect, etc. But starting with the medical need, and then we'll get into sort of the right now medical need, not down the road, but medical needs now.
Yeah, well, let me give a couple examples. First of all, what I've told people, and it's hard for people to believe this, so I'll preface that because not everyone's going to believe this. I saw more pathology in 2 days than I'll see 2 years in the United States. The pathology is severe, it's more advanced and more prolonged than anything that ever will see in the United States. Let me give you one example. I saw a 12-year-old with club foot. The club foot was so severe that he was walking on the dorsum of his foot. He was walking on his cuboid, on the top of his cuboid and talus. Literally, the head of the talus created an osteophyte. And I'm not, I'm speaking to surgeons that they're going to know what I'm talking about. They created an osteophyte that was bigger than any bunion you've ever seen in your life. And to the point that his whole skin was calloused on the dorsum of his foot. And he's 12 years old. Now, in the United States, I was a clubfoot surgeon. I was the expert that for 300 miles that people would come to me. So I spent, early in my career, until I got focused totally in spine, I spent a couple decades doing club feet, but I would typically see them at a month. And then, you cast them and you treat them. And if it doesn't work, then you do your clubfoot surgery. This was the worst clubfoot surgery I've ever seen in my life. I trained for over a year at the Shriners Hospital for Crippled Children. I did club feet every week. This was the worst one. It took me 3 to 4 hours. And for anybody that's done clubfoot surgery, they realized, okay, that either you're really, really out of practice, which could be, or it's really severe case. But I had to use every technique that I had, not just releases, tendon transfers, bone resections, opening osteotomies. I used every trick in my bag of tools to be able to get this foot. and I was able to do it. But it is not the expectation. You're used to a certain frame and a spectrum of patients. If you're into doing degenerative joints in the United States, someone will come to you and their hip arthritis is relatively mild compared to what you'll see there. Theirs, you'll see that the head will be destroyed. And I saw heads that were destroyed. I saw knee joints that were totally destroyed, like nothing you've seen in the United States. And these people were still functioning. They're still working with severe pain. It's amazing what they'll put up with. It's amazing what the body can do if it has to do it. And but that is not the expectation of a typical surgeon. You expect a certain range. It's going to be beyond what you've had. So you have to come in with your eyes wide open saying, if you're an OB-GYN surgeon, you're going to see a bigger fibroid than you've ever seen in your life. That's the kind of stuff that I'm talking about. It's challenging, but it's also the most rewarding thing you've ever done in your life.
Let's go there. So, all right. So now you've got the attention of our physicians, or some of them that are watching this. One, what are the maladies? What are the what kind of physicians are we looking for here? Two, and let's get into like sort of what to expect on this sort of, we'll come on a Saturday. We're looking for 3 clinic days is what we're shooting for Monday through Wednesday. What does this look like? I believe there have been several medical teams that have come down. Maybe sort of like which specialties are we looking at? What kinds of, what are we treating? And then what does it look like specifically on those days? And what can we expect?
Well, it's a similar spectrum of diseases you see in the United States, except for the fact that there's a lot of parasites and a lot of stuff that you don't see in the United States in addition. But you'll see hypertension and diabetes and all the typical things. But when you see a hypertension, you'll see somebody that's 200 over 140 that's untreated, or it. And so what you have to think of is, if you're coming from a surgeon standpoint, let's say you're a plastic surgeon. They will be able to find, syndactyles and cleft palates, cleft lips, and they'll be able to find other deformities that need surgery. And what I would recommend for any team going down, especially if a surgeon wants to do surgery, they have the ability to do surgery, but you have to think that you need to bring a team. You have to have somebody that surrounds you. Every surgeon goes into surgery. They're not the only one in the room. They got an anesthetist, they got a first assist, they got a scrub tech, they got a circulating. And so my sister, who's been a nurse for 40, 50 years longer than I am, she's older than me. She has first assisted me before, but she was primarily the circulating nurse. I have a good friend who's was surgical tech for me for 30 some years. And he's first assisted, and he also did the tech, but he also did the sterilization of the instruments. And then I have anesthetists that I work with, and I brought an anesthetist down, I brought a surgical tech down, I brought a surgical, circulating nurse, which could also dub in as a scrub nurse. I brought this team to surround me to be able to do the surgery, and that's what you have to do. The second thing you need to do is you need to tell them ahead of time, give them months notice, saying, okay, I really feel that God is calling me to fix these deformities. Let's just call it syndactyles, because there's all kinds of congenital things that are untreated, cleft palate, cleft lip. I saw syndactyles in a teenage girl that wanted her fingers freed up. And these are the type of things that they can take pictures of and send it to you, and you'll know, so you can prepare for it ahead of time. And you say, okay, this is what I'm going to do. I'm going to take care of. You're only going to be there that short time. We were there 2 weeks, and it was hard to do it in 2 weeks. If you're only doing a few days, you need to hit the ground running, which means you need to see them ahead of time. And they've got good internet, and so you can do a video, you can do a Zoom, you can do a FaceTime. WhatsApp is really the way to go, because WhatsApp does a video and it's free down there. And so they can do a video, they can show you let's say it's a syndactyly. They'll, you can look at the hand and get an x-ray of it. They'll send you the x-ray ahead of time. If you need scans, they can get that. They're difficult because they have to go like 4 hours to get a scan. So don't just order any kind of scan, but it's got to be something that you really need. but that's stuff so that you're prepared. So day one, you're ready to go to work,
So,
and
so just to repeat back what you're saying so that I understand and my clients understand. So, point one would be a team. Having
yes,
your anesthetist, maybe a nurse in the room with you. Now, either they bring them down or they say, "Hey, Randy, I'd like to come. I don't have a team." So I'd like the answer to that thought too, because maybe then we can prepare that as well. If somebody feels led to come, just say yes, I'm interested, and then let us do our work. If you don't have a team, let us do our work to see if we can put a team around you. But perhaps that's a response. The second thing I hear you saying is if you are doing procedures, surgeries, because then my next question is going to be, what about things that you could actually just do on the spot? What about having, George talks about 500 people coming through in a day, and I'm guessing all 500 didn't do a video call beforehand, that there's going to be
no,
some
no, no.
things you
We
can.
saw 525 the 2 weeks we were there. I saw many patients. 525 the 2 weeks we were there.
Gotcha. And so that's so then if a surgeon that's going to do procedures and they know who they are, that would want to see, that is a possibility, is what we're saying. Through a WhatsApp, you'd be able to sort of, on Monday, we've got these surgeries planned, and we're actually going to plan for them to happen inside of the Compassion on Wheels. Is that what I'm hearing you say?
Because they're not used to, they're going into a situation that's foreign to them anyway. It's going to be different. It's going to be a lot more crude. The other thing is I need to set the expectations. This is, you know, you're not getting all the frills and all the things that you normally would get in an operating room. I just told Randy before we started the call that I spent my whole life getting up, getting dressed, going into the operating room, washing my hands and sticking my hands out, and somebody put a gown on me and a glove on me and I went to work, and I never thought of everything that happened in between time. Someone has to clean the instruments, someone has to wrap them, someone has to sterilize them, have to prepare the whole operating room field, everything that has to be done. We do it the same as if it was done in the United States. We do it with the same degree of cleanliness. We don't want to cut any corners, and we want good results. But on the other hand, you have to be prepared. You have to have a mindset to be prepared. You're not going to do 5 cases the first day. You might do 2, or one big one or something. Because it's you've got 2 sterilizers, and you might, if you have to re-sterilize the same instruments, you have to think about all these things.
And just part of the sales pitch here is like, but remember, even if you do the one, you've got a Guatemalan team or physician, or at least there's one, it's Dr. Peter, I believe,
Yeah.
who's watching you, the idea here is that you're not just down there doing this stuff, you're teaching people how to fish. You're not just fishing
Right.
and giving them. So I guess that's part of it too, is don't feel like your time is inefficient because you're still, first of all, that patient didn't have another option. But second of all, you're training the Guatemalan physicians that hopefully will take over one day, and they'll watch your expertise.
Every specialty is going to be needed. Pediatrics, internal medicine, family practice, dentistry is absolutely huge. You can get a dentist or a dental hygienist, they will be nonstop busy. Physical therapy, there's all these kids that are there, that there's something like 98 in the Ray of Hope program. They're all disabled kids. They all need physical therapy, and they have one therapist for 89 children. And there's no
We
way
met
that
her.
yeah, but there's no way that one
Yeah.
therapist can take care of all of them.
Well, and there's
And
neurology slides, I believe, that like they were in need of a neurologist to read
oh
some of
yeah,
those slides.
yeah. The only physician I think that would be bored down there would probably be an oncologist. I didn't see any cancer.
What I'm hearing you say is, if I'm a physician, and I'm willing to give up a week of my life and potentially some preparatory time in advance, perhaps maybe we have newly retired physicians, by the way, that are interested in finding meaning in their life. I know Jeff had a client that retired to come back to work because I gotta have something to do. And so if this is the case, what I'm hearing you say is, if you are willing and you're a physician, we will find work for you, and we can even potentially be like, if it's far enough in advance, we could potentially put a team around you and really get some bang for the buck here. But the sooner we know, and the sooner we
Right.
know, kind of, who you are, what your specialty is, let us do our work to try to build a team around. Don't worry, don't let that be don't let that be a deterrent yet. If we just can't find the team and you're not willing to do some of the more menial things, great. No harm, no foul. We'll just part ways and then just say this might not be the trip for you until we can find a team. But at the very least, if you're a physician, you're willing to give up the week, and maybe you have a son, a daughter, a spouse, a partner, something like that that isn't medical. By the way, I'll just put this in here. We're going to try to build 2 homes for widows while we're there. And so that's just I don't have any construction expertise. In fact, I am a big liability on the construction site, but I'm still going to try. And so I'm going to pick stuff up and move it from A to B. And then there are going to be construction managers that are going to tell us how to do that. So that's another option in addition to some of the non-medical services. But maybe, is that summary fair, that if you're a physician, the sooner we hear from you, let us do our
Yeah.
job to try to build around you, find the cases. We'll design the trip for you, because we only plan on
That's
bringing
it. You
three
can
to
actually
five
design the
doctors.
trip. Right. And you're going to still see stuff that's out of your spectrum of practice, and it's going to stretch you. You're going to use, like, for example, I'm an orthopedic spine surgeon, and they asked me anything that was related to the back or any kind of nerve function. They asked me, so I'm not a neurologist, but I diagnosed the first time a case of Lou Gehrig's disease. And I'm 100% positive that's what it was. There's no neurologist anywhere within 4 or 5 hours. And so you're going to see stuff that you haven't seen before. And I've never seen a case. Well, I've seen Lou Gehrig's disease, but I've never been the first to diagnose it. You'll see stuff like that, it is amazing. But the thing is, I wanted to make sure that everyone left with I'm going to give you an example of something simple that I did. Something very simple is removing hardware. This young man, he's 24 years old. 10 years ago, he broke his femur, and he was fortunate enough he was in a different location, and somehow he got it femur rotted. So he got the femur fracture healed. He had a very poor system put in. It was actually designed and built in Guatemala, and the rod, the screw is broken to 5 pieces, one of which was loose in his joint. So it had been loose in his knee joint for 4 years. His knee joint was so swollen that the joint itself actually ruptured, and the fluid of the joint was actually in the subcutaneous tissue. So it was just palpable, in the skin tissue. You could just feel it, the fluid in there that was literally leaking from this huge joint that was easily twice the size of a normal knee joint. And here I am. I saw this in my first week down there, and I knew somebody from Zimmer, that's an orthopedic company, was coming down. I said, "Hey, can you bring me some hardware removal tools? I got this hardware I got to get out, and I have no tools to get it out with." And so he did. He came down with them, and he brought these tools with him. And so I was able to get the hardware out. And so he's 24 years old. So for 4 years, he had a loose screw in his joint with the swollen knee and couldn't work. So in that country, there's no social service, there's no welfare, Medicaid, Medicare, Social Security. Unless his family took care of him, he was totally out of luck. He would starve. And
Did
so
you do this
let me finish. So by taking this screw out, I've restored this guy to be able to work again. His knee pain was gone when I removed it, and he can go back to a relatively normal life. You can do that. That's the thing, is you can make such a huge impact on life that would normally be wasted.
It's life transforming.
Right.
The direction of his life is completely transformed because there are not other options there.
That's right.
Did you do this in a tent? Did you do this at the local hospital? Did you rent space there? Did you do this
No,
in
I
the
did this in the
compassionate
bus. I did that in the bus. That surgery was done in the bus. It's done. Yeah,
Okay.
I did the hardware removal in the bus. Yeah.
So I'll just do a conclusory sort of statement and then see if you have any other things to add, because that is a great illustration of the life transformation. I think people suspect that, but to put an actual story to their suspicions, I think, is exactly what we're looking for. Sort of in conclusion, what I'm hearing you say is sort of what we'll say is, look, we can only take X amount of people. We have chosen to make that around 20, and that includes non-medical. And my wife and I are two, Jeff and Kim are four. You know, that's another, my brother and business partner, Jeff, and his wife, Kim. So that's four people right there. I mean, we really, even if we had 20 different doctors, we can't design a trip for 20
No,
different physicians.
no.
So what we're targeting is kind of 3 to 4 doctors. And from there, sort of, I'll just sort of pitch it this way to our clients, and then correct me if I'm wrong, but I'll sort of say, hey, if you're interested, first come, first serve, and we'll design the trip around you. If you have interest, you get to dictate what we do and what procedures are done on Compassion on Wheels. And the first people to tell us that, and we've already had 2, by the way, express pretty serious interest in coming down. So that's sort of the call to action that I would sort of put out there. What would you say as far as a call to action, and any other concluding thoughts that we didn't get to today?
I would say the ideal team. I couldn't have imagined this, 6 months ago or further before our team was actually put together, and they just kind of all fell together, but it was perfect. I had a pediatrician, an OB-GYN surgeon, an internist, a dentist, and myself being an orthopedic. 2 surgeons, 2 medical doctors, and a dentist. And I think that that's a perfect composition of a group. I wouldn't put more than 2 surgeons just because the turnover is too slow. Now, obviously, you're seeing patients, you're doing follow-up work in between cases. Yes, your time's not wasted, but to be able to cover all age groups, like to have an internist and a pediatrician, was really, really helpful. I was missing a dental hygienist, which would really be nice to have had a dental hygienist. But it's even if you don't have a dentist in your group, minimum you should have a dental hygienist, because their dental is just abysmal. They have no dental care. But that's kind of the group that you want to think. You want to have 2 surgeons, different, of course, and so because we have different instruments, and a plastic surgeon would use different instruments than an orthopedic surgeon, and vice versa. OB-GYN, she brought her own kits, so she could do a C-section or anything on hers, and she was responsible for bringing her own equipment, which she did, and still there. The other thing is, before you come, if someone's going to come, they should probably talk to me, and we'll tell them what instruments and what is there and what they need to bring, because we had to bring everything, but we left it all there. So there is a lot of stuff there, particularly from instrument standpoint, retractors and, needle holders, and most of the common instruments that you're going to use are there. Some of the supplies we ran out, like gowns and paper drapes, sterile drapes and things like that, kits that are ideal to bring some with you. But in a perfect world, you can bring the stuff that you need with you. But when you get your group together, they should probably talk to me if they want to do surgery, and I'll tell them what's there, what do they need to bring.
That's perfect. Anything that we missed, or any other thoughts that you would want to share?
It's a different setting than you are normally accustomed to, but it's absolutely wonderful. It's something I've always wanted to do.
And if you have clients that say, hey, Jesus was a great teacher, I don't worship him as God, can I still come? What would you say?
Anybody that's coming, this is a Christian organization, and we're going to, that's what we're going to follow. That's, a person, they need to understand that. They don't need to necessarily, some people aren't, well, I'm not comfortable praying with my patients. Well, there's going to be somebody that's going to pray for that patient, before and after. And you don't, that's not a prerequisite, but they need to understand that's the organization. That's what they're about.
That's the organization. Yeah. Cool. Well said. I really appreciate your time. This is exactly what we're looking for, as far as I think, this is one of those things where take it or leave it. This is what it is. We don't want you to be surprised when you come down there. So the call to action is this. Clients, if you have any interest at all, ask your advisor, obviously, contact me. And if it gets more serious of you sort of signing up and coming down, we would connect you with Dr. Matthew Songer here. And, you can do an introductory phone call even before you sign up. But just know that if two surgeons sign up and you're a surgeon that wants to sign up, we're probably going to say, I'm so happy you want to come, but I don't know how many, how much the trip can be designed around you. Maybe we push it to a later year. So if this is something you just feel that tug, this is one of those things that we went for a week last year, and it was one of the best weeks of my year. And I would say that of pretty much any mission trip that I've been on, when I get outside of myself, outside of my comfort zone, outside of my schedule, and just dive into serving other people, it is truly rewarding. And I think that Matthew, you'd say the same thing. This is not you're not doing it for the money. Actually, I don't think you get paid anything. It's probably costs you a lot of money.
It costs you money. Yes, it does. But it's but it's very rewarding. Yeah.
Yeah.
Yeah. No, I'd be happy to talk to anybody too if they have interest. The other thing is, it's our goal that over time we would have teams that every month, every couple of weeks, there's a different team going down. So that's not unreasonable, especially once a hospital gets built, to be able to have a regular rotating teams that go down there.
Yeah, I love it. This has been informative, helpful. Thank you so much. And we will be in touch, and we'll see who's interested here. But I really appreciate your time today, and for allowing us to partner with you, and we'll see where this goes, but appreciate it.
Okay, thanks.